Daytime Doctor TV is about to change. The days of traditional dental thinking are over. We're here for dental consumers who are tired of crowns, tired of repeated invasive procedures and dealing with problems in their mouth that seem to never go away. There is a better way. There is an alternative approach leading to whole mouth and whole body health for the rest of your life. Stay tuned to learn more now. This is the Dr. Shoup Show. Here's your host, Dr. Randy Shoup.
Hello, everybody. My name is Dr. Randy Shoup, and I am here to bring to you something totally unique, totally something different, and totally something that will possibly change your life. And that is this program. This program, the Dr. Randy Shoup Show, is going to bring you the most cutting-edge information in the world of dentistry, in medicine, in nutrition, in health, and wellness. We're going to bring to you the information that you need to make really high-quality decisions about what you do in taking care of your body for the rest of your life. I am a dentist, and I am a dentist in Indianapolis, and my office is called Microscope Dentistry by Shoup. The name says it all. I do my dental work through a surgical dental microscope. I look at your teeth under extremely high magnification so that I can find problems with your teeth significantly earlier, quicker, when the problems are smaller than any other dentist can. We then can use techniques called biomimetic dentistry. We can use these techniques to restore your teeth to as close to what Mother Nature really intended them to be. We don't grind great big holes in teeth with a drill and fill them full of filling material. We don't grind your tooth down to a little nub and put a crown or a cap on top of it. Those are absolutely the most destructive things that a dentist can do to your teeth. Unfortunately, that's what most dental schools teach. Unfortunately, that's what most dentists learn how to do when they're in school. And unfortunately, very few dentists avail themselves of the education, of the training, of the expertise that is available to learn these newer techniques. I've always been kind of a science geek, and I've always been somebody who really never was satisfied in the status quo. What is the better thing on the horizon? What's the best material that I can find? What are the best techniques that we can possibly use to restore your mouth to a state of health and well-being? That's what this show is all about. We are going to bring to you on a weekly basis a parade of experts that is going to talk to you about various aspects of your dental health and your overall health to make sure you have the information. This is information you will be able to find no other place. We want you to be here with us each week to learn a new chapter, to learn a new piece of information that you can take and incorporate into your healthcare plan so that you can make the best decisions possible. Today, we get to meet an absolute world expert. We get to meet Dr. David Alleman. Dr. David Alleman is a dentist from Provo, Utah, and he is really one of the pioneers in the entire world of biomimetic dentistry. He literally sequestered himself in a research library for over 5 years and did the research necessary to develop these techniques. The techniques that he's going to tell you about are the most preventative, conservative, least invasive dental techniques on the planet. And I have been fortunate to have taken study with him. He is my mentor, and I have learned all of the information necessary to literally revamp my entire career as a dentist. Let me ask you this. How would it be if you went to your dentist and your dentist said, you know, I can restore your tooth without grinding it down and putting a crown on it? Would that be an advantage to you? Would you like that? How about if you went to your dentist and your dentist said, you know, your children have early cavities in their teeth, but I tell you what, we don't have to numb them up. We don't have to use a drill. We don't have to make holes in their teeth. I can remove the cavities from their teeth without any of those things, painlessly, easily, and the restorations that we put in your children's teeth will probably last them for the rest of their life. They shouldn't have to be replaced all the time. How about if you went to your dentist and the dentist said, you know, everything looks perfect. I don't expect you to need any dental work for a long, long time. Would that be an advantage to you? Would that be helpful for you? I bet it would be. So right now, we're going to meet my mentor, Dr. David Alleman. Well, welcome back, everyone, and I cannot tell you how excited I am about introducing our next guest to you. We have, coming to us from Beverly Hills, California, Dr. David Alleman. David, how are you?
Very, very happy to be here with you, Randy.
Thank you very, very much. Now, I want all the viewers to understand Dr. Alleman is truly a mentor of mine. I have learned so much from him over the years. It has truly revolutionized, changed everything about how I practice dentistry, how I can practice dentistry so much more conservatively for my patients. I want you all to also know that this man is truly a world leader. If anybody has questions about what is called biomimetic dentistry, you call David Alleman, and he is the font, the source of all information. And so, David, for our listeners, would you do me a favor? Tell people what biomimetic dentistry means. It probably doesn't have a lot of name recognition, and they don't really understand what that sort of dentistry is. Give us a quick definition.
So biomimetic dentistry is the type of dentistry that allows a dentist to make a connection of the tooth so it bonds the tooth permanently. And so you're able to just take a small amount of decayed tissue away, but you're able to replace or add back what is missing. There's no cutting down of the tooth for a traditional filling or cutting down of the tooth for a traditional crown. And this type of bonding seals the tooth from infection and allows that tooth to heal and prevents root canals or nerve death in the tooth. So it's a real great breakthrough in dentistry.
Now, explain, I know the answer to this question, but my listeners don't. Where did this come from? I know you've done years of research looking at the science and the literature behind it, but where did all this technique come from? And is it traditionally taught in dental schools now? Who knows how to do these techniques?
That's a great question, Randy, and it's a little confusing for patients because a patient goes to a dentist and they thinks one dentist is the same as the other dentist. Nothing could be really farther from the truth. This biomimetic advanced adhesive dentistry has evolved over 30 years from around the world, from researchers, scientists, chemists who have been able to create these bonding materials to the tooth and be able to create techniques that allow this bond to be tooth-like, to be as strong as a natural tooth. So it's really, the research that I did took me about 10,000 hours to do. That's about 3 hours, 4 hours a day for 5 or 6 years. And by putting together this science, we were able to create protocols and teach dentists like yourself how to exactly get the bond to be very strong and stay bonded for the lifetime of the tooth. So it's a worldwide network of maybe 1,000 dentists like yourself right now who have been trained to a high level. But there are many hundreds of thousands of dentists, and we have a lot of work to get more dental schools trained. University of Geneva is the leading dental school in biomimetic dentistry, and they've been teaching this exclusively for over 10 years. University of Southern California is doing a good job. Dr. Pascal Magne there has been a leader and a collaborator with myself in developing these techniques. Dr. Simone Della Peri in Italy, we've partnered for over 10 years. And so the network of teachers and the school, it's growing. And that's why we're so excited that you have this television program that you can let people know that there's a new kind of dentistry that is just beneficial to them.
Well, you bring up a really, really important point, and we've been throwing out some terms like bonding and adhesive dentistry. And for my viewers, what we need to help them understand is, traditionally when you went to the dentist, they would put in silver mercury fillings. They would drill a hole in your tooth and then pack it filled with this concoction of mercury and silver. It would harden, and you and I know it as silver fillings or mercury silver fillings or metal fillings or black fillings. Several years ago, people decided that they wanted something more aesthetic, and as the research came about for tooth-colored fillings, people wanted tooth-colored, then we had to figure out a way of getting the tooth-colored stuff to stick into the tooth. And that's where this adhesion, the tooth-colored material adheres to the tooth. And then we take it a step further in that we want this material actually to bond, to become part of the tooth. And so that's what Dr. Alleman's talking about in terms of adhesion and bonding. The tooth-colored filling material operates and acts entirely differently than how old mercury silver fillings acted. And unfortunately, many regular dentists have adopted and taken tooth-colored filling material and used it as if they were back in the days of using the old mercury silver filling material. They use the material pretty casually. They use the material without the absolute fanatic precision to technique that has to be followed. It takes longer to put them in correctly. And what we find is that in today's world, the average life expectancy of a tooth-colored filling done by a non-biomimetic dentist is 6 years. That's the average life. And so your filling, your tooth-colored filling is going to be shot, leaking, have decay under it, have fallen out in 6 years. David, tell people, if you follow the biomimetic principles, if you restore teeth like you and I know how to restore them, how long should their restorations last?
So right now we have restorations that are over 20 years old that are not breaking down. And so if a restoration is lasting 4 times the national average and they're not showing signs of breaking down, we believe that these are on the road to being permanent. We have perhaps a chip of a filling would be similar to a chip of a natural tooth. Natural teeth do chip, and those chips, if they're on the outside of the tooth, are not harmful to the health of the tooth. And these types of successes have now been replicated into the 500 dentists that I've trained over the last 15 years, my partners and I. And Dr. Manya has had similar success with the 500 dentists that he's trained. So we have the ability to say, this is a revolutionary type of dentistry. And this is like a major breakthrough in being able to have a tooth fixed once and pretty much say this tooth is not going to have much or any work at all in the future.
Well,
so it's a great breakthrough.
Yeah, it is a great breakthrough. One of the things that you're talking about, I want the viewers to understand, is that you and I talk about what we call the restorative life cycle of a tooth. And that is where the patient goes to the dentist, and the dentist says, well, you have a little cavity on the top of your tooth, and they numb it up and they put a little filling in it. Several years later, you go back and say, well, that filling is leaking or that filling has failed, and they grind a little bigger hole and put a little bigger filling in it, and then 6 years after that. So you start this sequence of restoring your tooth, and each time that happens, the dentist drills a bigger and bigger hole into your tooth. Ultimately, then the dentist looks at that tooth and goes, oh gosh, it's got more filling than it can hold. I can't put any more filling in the tooth because the tooth now has to have a crown or a cap done on it. So what you're talking about is circumventing that. You're talking about short-circuiting that from the get-go. We have the ability to put restorations in that last 20 years, and it completely lets the patient not restore their tooth, not spend money on that tooth for a period of 20 years, rather than spending money on that tooth every 6 years. That is a huge game changer for the patient.
Correct. The value is huge, and we just see it in all of the doctors that we've trained. We've had so many reports of hundreds and thousands of situations where traditional dentistry would have said this tooth needs to have a root canal, this tooth needs to have a crown. But by using biomimetic, we prevent the root canal, we prevent the crown, and we're preventing tooth loss in that 10-year failure rate that so many crowns and root canals see.
So virtually in my practice, like your practice, if a patient comes to me even with a massive size restoration, and we're going to show some pictures of teeth with really huge mercury silver fillings in them, that 99% of the dentists would say this tooth has to have a crown. You and I know techniques that allow us to restore the tooth without grinding it down further and putting a crown on it, and it should last over 20 years.
100% of the time.
Yeah, 100% of the time. It's amazing. Now, let me ask you this. How would a patient going to their dentist have any inkling or knowledge or awareness that their dentist is practicing biomimetic techniques, or are they practicing the older style techniques? How would a patient going to their dentist that they love and know and trust, how would they know the difference?
Yeah, basically, crowns are the watershed. If a dentist can recommend a crown, that means he doesn't understand or doesn't know or hasn't been sufficiently trained in adhesive dentistry to the ideas that you don't need to crown a tooth that is failing from traditional fillings being too large and starting to break down. And so the word biomimetic is now, if you type in biomimetic into the internet, you'll find myself, you'll find Dr. Shoup, you'll find Dr. Monye, many dentists are using this. And so it's going to become very prominent. Right now we have an Academy of Biomimetic Dentistry that has an annual conference of 100 or 150 doctors, and these practitioners have the advantage in their areas of becoming experts and key opinion leaders, like Dr. Shoup is in Indianapolis. But you know, basically a connection with Dr. Shoup, a connection with myself, a connection with Pascal Monye, a connection with University of Southern California. Those would be the things that would really differentiate a dentist who has really been trained versus a dentist who just has heard of the concept. Or maybe adhesive dentistry has been around for a long time, and most dentists feel like adhesive dentistry that they are successful in the front part of the mouth, but the back part of the mouth where most of the dentistry is done, that's where you need to have the evolution into biomimetic dentistry instead of just traditional adhesive dentistry that can't hold up in the back of the mouth on molars.
So basically, for the layman, for the average patient going to their dentist, if they go into their dentist and their dentist is recommending you need crowns on your teeth, that tells you pretty much right off the bat, this dentist has not embraced the significantly more modern, more up-to-date, more conservative techniques of biomimetic dentistry. That pretty much is the watershed point right there.
Yep.
Now,
that is.
Yeah, exactly. Now, you and I know, and you know, we've both been to Dr. Della Peri's office in Sardinia, Italy, and studied. And I brought a operating microscope. I do my biomimetic dentistry through a dental surgical microscope because I want to do things as tiny and conservatively as I possibly can. One of the other kind of key factors for me is if the regular dentist is not using magnification. How important is magnification to doing biomimetic dentistry well?
It's absolutely essential. My son, who's been a dentist now for 3.5 years in the Army, graduated from dental school 3.5 years ago. In dental school, he went to a 6-power magnification, which is close to a microscope. Microscopes that I've been using for over 20 years. You've been using the microscope that long. When you get to a 6 to an 8 magnification, the world of dentistry becomes so much easier as far as diagnosis and treatment. And so I can't recommend highly enough the idea of magnification. I know you've been a leader in the Academy of Microscopic Dentistry, and you were in Philadelphia last week, I think.
I was.
And that is just a huge part of doing this correctly.
Yeah, I will tell you that, having learned the biomimetic techniques from you several years ago, and then coupling that with what I do already with using the surgical microscope, I'm routinely at 16x and going up to 20x and then even up to 30x in terms of refining things down and making them small. The advantage to the listener, the advantage to the patient is the fact that I can go in and make teeny, teeny, tiny holes in teeth where a regular dentist looking with their regular eyes or with very low levels of magnification are going to have to make big holes in your teeth because that's all you can see.
Correct.
And one of the other aspects that really makes a big difference in terms of biomimetic dentistry for you and me is that we can treat patients a large percentage of the time without having to give them a shot, without having to numb them up, and without having to use a drill, because you and I have learned the techniques of what's called air abrasion. That's a microscopic sandblaster that we can clean the teeth out with. Talk to me about how well your patients respond to the fact that they're not having to be numbed up and drilled on as much as what they've been traditionally used to.
Yeah, it's huge, and this air abrasion concept that Randy lectures or that you lecture around the country on, and I've been using for 20 years. It's something that is a real game changer, especially with children. I mean, to not have to give a shot to a child just makes it very, very pleasant. And, I'm 67 years old. I have no problem treating my grandchildren and children of patients because it's a whole new way to do this without an injection, without a shot, without a drill. And so air abrasion, that allows the treatment of dental disease when it's the smallest, and that prevents that circle of retreatment and circle of death in traditional techniques.
What I tell my patients and what the folks that are watching can kind of probably have resonance with is the fact that, let's say you go out and you look at your car sitting in the driveway and you see a little teeny tiny dot of rust on the fender of your car. Now your choice is this: do I fix this rust when it's tiny and small where it's easy to patch, or do I wait for the rust to be the size of a coffee can, then go fix it? What you and I have the ability to do is fix the rust on a tooth when it is absolutely teeny tiny. We don't have to give shots. We don't have to numb people up. Regular dentists wait for the decay, the rust, to be the size of a coffee can. Then they have to go in, numb people up, drill big holes in their teeth, and then put large restorations in their teeth. You mentioned something really important, and real quickly here in our last 30 seconds or so, about treating children. Children, biomimetic dentistry for children is truly remarkable.
Oh, wow. It's a real game changer. One of our mentors, Tim Rainey from Texas, is 74 years old. He treats only children all day Tuesday in his office in Refugio, Texas. And it's just like most dentists have such frustration treating children. They stop doing it when they're in their 50s. It's such a game changer that it's part of the biomimetic, what we call the whole enchilada. You got big problems, you got little problems. If you start by treating the rust, then you never have to replace the whole fender.
Yeah. David, I cannot thank you enough for spending your time with us. I know we've encroached on a really, really busy day of teaching and research for you. Thank you very, very much. Your information is invaluable.
Randy, you're one of my heroes, and I just appreciate everything you're doing to spread the word.
Thank you, my friend. I appreciate it. Well, there you have it. There's more information than I'm sure you ever imagined. You know more now about biomimetic dentistry than probably most of the dentists that you go to. I want you to take that information and use it to your benefit. If I can ever be of help to you, I'm Dr. Randy Shoup. We operate with biomimetic dentistry every day in Microscope Dentistry by Shoup. The name says it all. I use a microscope to treat your teeth. teeth, if you feel that a more conservative approach is to your advantage, if you feel that it would be better not to have shots, not to have to be drilled on in your teeth, not to have large restorations put in your teeth, then we may be the source that you're looking for to change your dental future. And so please don't be hesitant to give us a call at any time. So until you and I have a chance to chat again, be sure to brush and floss.